Welcome, everybody. That's Oliver. He wants to welcome you to week 3 of medical terminology. We are going to talk about the integumentary system today. Very fun, right? Have you been having fun all week long? Yeah, because this is a collection of skin, the largest organ in the human body, plus hair, all kinds of hair, nails, toenails, fingernails, glands, pits, and the nerves, the part of the nervous system that integrates with the skin. So before we get into the specifics of the integumentary system, I would like to know, do any of you have any questions? Did you bring any questions with you? You didn't know there was homework assignment, huh? Okay. That's fine. We're going to look at good pictures because I think that's one thing that I love about anatomy and physiology. I think pictures show us exactly what we need to know, as opposed to just conceptual. So if you look on the right side of this section of the skin, well, first you just look at the whole thing and you can see how complicated and interactive the skin is. Essentially, there are 3 layers to the skin. The epidermis, which is the outside, okay, superficial. The dermis, which is the next layer. And then this particular illustration uses the word hypodermis, and you learned hypo means below. Dermis is the level right above it, so that's kind of easy, right? But this is also called the subcutaneous layer. So as you have experience and as you go through the vocabulary, you will note that more often this layer is referred to as the subcutaneous or sub-Q. And you will most often see this with relation to how an injection is being given. Okay. So, you have injections that go into the muscle. And then you also have injections that go in that are injected subcutaneously, which means they're going to go into this yellow part here. Okay. Of course, you have blood vessels in your skin because that's what happens when you prick your finger or maybe get a laceration, commonly known as a cut. Okay. On the left side, you can see the other aspects of what we call the skin. Okay. We have the hair follicle, and we're going to look at that in a little more detail in a few minutes. The sweat glands, I'm sure you know about that. Okay. Fat, also known as adipose. And I find it much more comforting to refer to my hips as having hyperadipose, because it sounds right. Doesn't it sound? It sounds a lot more, official than fat. Okay. And then, of course, connective tissue, which keeps it all together. That's like the mortar between the bricks. Okay. But this is important because as you get experience reading nurse and physician documentation, you will see references to these aspects of the layers of the skin. And it is important that you know to what it is referring. Okay. All right. And as I said, and you can see in this description, it does call that third layer the subcutaneous tissue. And as I said, that is the more common reference. But if somebody says hypodermis, you're already going to know what that means, right? Because you took medical terminology. Oh, okay. All right. All right, the next aspect of the integumentary system is the hair. And as human beings, we find that we have hair everywhere. Sometimes in places we're happy to have hair. Sometimes in places we're not so happy to have hair. And different people have different feelings about that. It's interesting that bald people are very interested in having hair on their heads. And yet we have people like, I shave my legs because there's hair there that I don't want to have there, or at least have anybody see it. Okay. So this is the way that works. You notice here on the right side of your screen, you have the hair bulb, which is that's the root. Okay, that's where your DNA is. And you can see that the veins and arteries connect into your hair. Now, that's interesting, isn't it? Because if you pulled a hair out of your head by its root, or if you, I mean, you're women, so you know about plucking your, I shouldn't just say that, urban men do that too, pluck their eyebrows. You know, you pluck a hair out, it doesn't bleed. So it's kind of curious, but because hair is a living thing, it does need to be nourished. So you'll notice that the artery and the vein kind of loop, but there is no opening. It uses osmosis to feed the bulb so that it can grow. Okay. The hair follicle is the part between the bulb, the root, and the surface of the skin known as the epidermis, right? Okay. Then we have the oil glands that run alongside of the hair. And again, this is something that you might be familiar with. And I think it's so interesting. This is one of the fascinations I have with human anatomy, is this is not a cookie cutter thing. And we all know that, right? All you have to do is watch a shampoo commercial and you know that there are some people who have more oil on their hair and want it there. Okay. Then there are women who have oily hair, but they don't want to have oily hair, so they get the anti-oily shampoo. But then you have women, men, everybody, who has dry hair, in which case you want to have more oil. So it's important to me that in this beginning of your medical healthcare education, that you do remember that even though the structure of the human body is pretty well set and has been for thousands and thousands and thousands and thousands of years, the fact is that people are not alike. And we always want to take in consideration to who the patient is at the time. Whether you are going into clinical, where you will actually meet face-to-face with the patient, or whether you're going into medical record coding, where the patient is represented in documentation, the fact is that we want to make sure that we understand that each patient is each patient. Okay. All right. The hair from the epidermis extended out is the shaft, the hair shaft. Okay. Now, and again, there's that other fascination with the fact that, you know, you can pull out a hair and it'll grow back, and it won't grow back. A new hair will grow back in its place. But then again, you have bald people where it doesn't grow back. Now, sometimes that's acquired, you know, a patient who's going through chemotherapy or radiation treatments may retard. That's not a bad word. That just means change from the normal, okay, the replication function of the hair, okay? And then often it will come back after treatment, and sometimes like my Uncle Artie when I was growing up. And we used to say, "Where's your hair, Uncle Artie?" And he would say, "It's at the cleaners." I was 5. What do you want? Okay. All right. Now we have nails. Okay. Thank you for laughing. You know, I told you, I think in our first week together, I inherited my father's sense of humor. So, all right. Nails. I'm sure you're familiar with your fingernails and your toenails. Okay. And essentially, the structure is the same. Now, what I find really interesting is there is no medical specialty involved in nails, right? I mean, you have medical specialties that cover every other subdivision of the human body, but not nails. So the dermatologist is the one who needs to be responsible for this because it's part of the integumentary system. All right. So you can see that each part of the nail has a different term. You have the free edge of the nail, which is the white part. Okay. The dividing line, which is exactly that line between the white part and the pink part. The nail plate, which is the pink part all the way to your cuticles. The nail bed, which is underneath the nail, where upon which the nail is sitting. Okay. The lunula, which is half moon. So if you know the word luna is moon, that can help you remember this, is that little tiny half moon white spot, right? At the very top of your nail, right before the cuticle. Okay. And then this part of your finger or your toe, I'm pretty sure you don't want me to show you with my toes, right? I can do it. I am that fit, but we'll just use my fingers instead. Okay. The mantle is this part of your skin that kind of secures in the root of the nail, known as the matrix. Not the matrix with Keanu Reeves. This is a different matrix. Okay. All right. Any questions so far? All right. So the glands, the exocrine and the endocrine glands. The exocrine glands are the ones that secrete chemicals to the outside of the body. This is why if you ever ask the question, why do my armpits stink? Or maybe your groin gets all sweaty, because that's where they are, your groin and your armpits. Okay. This is why they stink, because they the exocrine glands excrete. See, I can say esophagogastroduodenoscopy. All right. That's a procedure where they put a tube down your throat and they inspect your esophagus, gastro, your stomach, your duodenum, and oscopy, which means to see, right? So I always say that when I can't say little words like excrete. All right. So you have sweat glands right there. You have lacrimal glands, salivary glands. Chocolate ice cream sundae. Sorry. Mammary glands as women. Yeah, you're all women, but even guys know about women's mammary glands. And men have mammary glands. Okay. That's why men who develop, or should say overdevelop in this area of their body, is called gynomastica. I wasn't prepared for that word, but that gyno means woman, mastica means mammary. That means man is developing female enlargement of the mammary glands. And of course, your digestive glands, which is where your stomach, your pancreas, and your intestines, your pancreas exudes bile as the digestive food is going from your stomach to your intestines. We'll learn more about that in the digestive system. Okay. Endocrine, endo means inside, exo means outside. So endocrine, and if you ever played any of those video games, you know, where they have the Transformers and they have an exoskeleton and they have that frame on the outside. That's exo is outside, endo is inside. These are the glands that work internally. They may excrete hormones directly into your blood system, and your pancreas participates in that as well. Thank you very much, the pancreas, a very useful but yet quiet organ. All right, who has questions for me? Anybody? All right, it must be because I'm such a good teacher. All right. Okay, really, really, really review this often. You will obtain and keep more in your head if you read it over the course of time 10 times than if you sit there and stare at it and say, memorize, 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 memorize. Okay. Use your medical dictionary. Seriously, why work harder when you can work smarter? And query when necessary. That is part of your job, no matter what your job is in healthcare or even as a patient. If you come across something you do not understand, you must ask. That is the right thing to do. That is the smart thing to do. Okay? All righty then. You know where to find me when you have those questions. If you want to, sometimes you need to talk things through. I'm all for that, or whatever. I am here for you. Okay. Make sure you review your assessments, tests, quizzes. When you get something wrong, go back and try and figure out why you answered it incorrectly and why the correct answer is correct. That will help you adjust what's in your head to the right, correct answer. Okay. All right. Okay. For those of you who are Jewish, Happy New Year, Happy Rosh Hashanah. And for everyone else, it's Thursday, which is right next door to Friday, which is right next door to the weekend. Have a good one, and I'll see you next week.